so I'm here on day 2 of the Specialty Coffee Association of America, and as I mentioned, I was going to try and speak to all of the charities and organizations that were helping people in the local communities. I'm here at Grounds for Health, which is specifically geared towards helping women in these communities prevent and deal with cervical cancer, which is a major killer of young women in particular. I'm going to be speaking with one of the volunteers, Sylvia Estrada, and she's gonna tell us a little bit more about Grounds for Health. Sylvia, thank you very much for taking the time to speak with me. Can you give me a little bit of a summary or an overview of Grounds for Health, please?
Sure. Grounds for Health is a nonprofit organization based out of Vermont, and we exclusively just go into coffee-growing communities.
Okay.
Where we know that there is a very high rate of cancer death for women due to cervical cancer. Yet cervical cancer is preventable by providing access to healthcare and pap smear screening.
Sure.
So at the invitation of the developing country that grows coffee, we go in with our volunteers, our physicians and nurse practitioners and nurses, and we educate the local healthcare providers on screening for cervical cancer and treating all in one visit. So we provide a sustainable program so that when we leave that country, the local healthcare providers continue to provide the same quality of service.
Now, in terms of from the local community, in terms of them continuously having the supplies and the ability to sustain that, does Grounds for Health also contribute financially to these communities?
Well, what we do is we want to make sure that we are able to teach them how to use their own resources. It doesn't take a whole lot of money to be able to sustain this type of cervical cancer program. Cotton balls, metal speculum, a light source, vinegar solution. That's basically what you need, and a good, ability to visualize the cervix is what you really need to continue this program.
When these people are suffering from cancer, what are the resources available for them?
We work with the coffee co-ops they obviously invited us, and we work with what health systems that they have in place. So if we do identify somebody with cervical cancer, the coffee co-op then helps them get to services that they need.
What are the facts in terms of what are the current rates of female death in these communities from this cancer? Do you know the statistics?
I don't know, but it's the #1 killer, cause of death for women in developing countries.
Okay, so cervical cancer is the #1 cause of death for women in
cancer death.
Cancer death.
Yes.
Okay, so cancer death in developing countries.
Right.
Okay, that's very serious.
Yeah.
Clearly.
And it's preventable because if you have access to healthcare and obviously access to like pap smear screening, you're able to prevent this.
You mentioned to me that there's a reception, so there's going to be a lecture on...
Yeah, we'll have volunteers and people that started the organization.
And you mentioned his name again
Dan
is...
Cox.
Dan Cox, okay.
Yes, he actually was in the coffee business, and when he went down to Latin American countries and he realized that a lot of these women that were picking coffee were dying. And he asked, well, why were these women dying? And he found out it was due to cervical cancer. And he says, well, how can we fix it?
Right.
And so that's how the concept started.
Well, thank you so much for your time. I think this is a wonderful cause. I think it's really nice to see something dedicated to women in developing countries. And as a young woman myself, you see many deaths of women that are in their 20s and 30s dying of this disease, and it's really tragic. So
yes,
especially when it's preventable.
Yes, it is.
So thank you for volunteering for them, and thanks for sharing.
You're welcome.
Okay.